Okay, welcome back. We will continue our video series on medical terminology. In this video, we'll go over chapter number 13, the nervous system and mental health. Learning objectives for this chapter: define and spell the word parts used to create terms for the nervous system. Identify the major organs of the nervous system. Break down and define common medical terms used for symptoms, diseases, disorders, procedures, treatments, and devices associated with the nervous system and mental health. Build medical terms from the word parts associated with the nervous system and mental health. And pronounce and spell common medical terms associated with the nervous system and mental health. Alright, we'll start off with some anatomy physiology for the system, with some word parts. We'll start with some very common combining forms. Cephalo is a reference to head. Cerebello is a reference to the cerebellum, the posterior part of the brain. Cerebro is a reference to the cerebrum, which is the largest part of the brain. Cranio is a reference to the skull. Encephalo is a reference to the brain. Ganglio is a reference to a ganglion or a collection of nerve cell bodies. Meninge or meningo is a reference to the meninges, which are membranes that cover the brain and the spinal cord. Myelo is a reference to the spinal cord. Neuro is a reference to a nerve. Freno is a reference to the diaphragm or the mind. And psycho is a reference to the mind. Radiculo is a reference to a nerve root. Vago is a reference to the vagus nerve. And ventriculo is a reference to a ventricle, either of the heart or of the brain. Alright, we'll talk about some basic anatomy and physiology of the system. The nervous system is made up of the brain, the spinal cord, and the various nerves. Now, these organs will enable you to sense the world around you, and also to form thoughts and memories, and to control body movements, and also a large variety of internal functions. There are two major divisions of the nervous system. You have the central nervous system and the peripheral nervous system. The central nervous system is just the brain and the spinal cord. Everything else as in the nervous system that's not the brain or not the spinal cord is a part of the peripheral nervous system. So all the cell bodies, all the nerves, all those fall under the general term of the peripheral nervous system. And the nervous system maintains your body's stability or your homeostasis. Alright, this illustration we have a superior view and a sagittal view of the brain, and it would be next to impossible to identify every major structure found in the brain just on one image. But here are some important features that are found in the brain: the various sulci and the gyri, the hemispheres, the lobes. I'll now talk about some pathophysiology when it comes to the nervous system. Now, the tissue making up the brain and the spinal cord and the nerves is delicate and very, very easily damaged. And there's an extra layer of protection that the brain is covered by, and that's called the blood-brain barrier. And that is there to help prevent many viruses and many bacteria from getting into the brain. It doesn't block out everything, but it does prohibit a large number of pathogens from entering the brain. But even with this blood-brain barrier, the nervous system can still experience infectious disease, exposure to toxic substances, injuries, and inherited conditions. Signs and symptoms for the nervous system. We'll start off with some word parts. The prefixes. A means lacking or without. Hyper means above. Hypo means below. Par means abnormal or other than. And poly means more than one. Some common combining forms you'll see with the system. Cephalo is a reference to the head. Esthesio is a reference to a nervous sensation. Neuro is a reference to a nerve. Phasio is a reference to speaking. Some common suffixes you'll see. Algesia is a reference to a sensitivity to pain. Algia is pain in general. Asthenia is a lack of strength. Ea is a condition. Alright, some particular signs and symptoms of the system. The first one, aphasia. This is the loss of ability to express speech or to understand speech. Cephalgia. This is a pain in the head, so another term for a tension headache. Usually occurs on the back of the head. Convulsion. Another term for a convulsion is a seizure. This is having a sudden, violent, and irregular movements of the limbs. And our next term, hyperalgesia. This is an abnormally heightened sensitivity to pain. The opposite of that, hypoalgesia, is abnormally lessened sensitivity to pain. Our next term, hyperesthesia. This is an abnormal sensitivity to touch or to pain or to other sensory stimuli. Neuralgia. This is having intense, usually intermittent pain on the course of a nerve, usually in the face or in the head. Neurasthenia, this is a term that's not used that much anymore. This is a psychological disorder that is identified by being easily fatigued, having a lack of motivation, feelings of inadequacy, basically lazy nerves is how it breaks down. Paresthesia, this is an abnormal sensation, usually a tickling or a pricking feeling like you're on pins and needles, and there's no apparent cause for that sensation. Polyneuralgia, this is neuralgia or pain in the nerves, but happening with many nerves all at the same time. And our last term here, syncope. This is a temporary loss of consciousness due to a sudden fall in blood pressure. This is when someone faints. They are experiencing syncope. All right, now we'll talk about some diseases and disorders of the nervous system and the word parts. The prefixes, a means lacking or without. Epi means above. Hemi means half. Intra means within. Mono means one. Para means nearby or locally or alongside of. Poly means more than one. Quadri means four. Some common combining forms that you'll see. Athero is a reference to plaques. Auto means self. Cephalo is a reference to head. Cerebello is a reference to the cerebellum. And cerebro is a reference to the cerebrum. Cranio is a reference to the skull. Embolo is a reference to an embolus, which is a floating blood clot. Encephalo is a reference to the brain. Glio is a reference to a glial cell, which is a supporting cell in the nervous system. Noso is a reference to knowledge. Hemo is a reference to blood. Hydro is a reference to water. Latero is a reference to the side or laterally. Meningeo is a reference to the meninges, the protective membranes that cover the spinal cord and the brain. Myo is a reference to muscle. Myelo is a reference to the spinal cord or of the bone marrow also. And narco is a reference to a numbness or sleep. Neuro is a reference to a nerve. Polio is a reference to the gray matter of the brain or of the spinal cord. Sclero is a reference to the sclera, which is the white part of the eye. Thrombo is a reference to a thrombus, which is another term for a clot. Vasculo is a reference to a vessel. And ventriculo is a reference to a ventricle, either in the brain or in the heart. The common suffixes. The first two, al and ar, both mean the same thing. They both reference pertaining to. Seal is a reference to a hernia. Ia is a condition. Ik means pertaining to. Ion is a process. Ism is a process or a condition. Itis means the inflammation of. Lepsy is a reference to a seizure. Malacia means the softening of. Oma is a reference to a tumor. Osis is an abnormal condition. Apathy references a disease. Plegia represents paralysis. Urage is a bursting forth of blood. The troph means nourishment or to feed. And the suffix us is a structure. So now we'll talk about some particular diseases and disorders of the nervous system. The first one, agnosia. This is the inability to recognize things or be able to process sensory information. So this means without knowledge. And it's usually caused by some type of brain damage. So our next one, AD, Alzheimer's disease. This is a progressive brain disorder that is irreversible. It is a type of dementia that will impact a patient's memory and thinking and then behavior. Our next term, ALS, amyotrophic lateral sclerosis, also known as Lou Gehrig's disease. This is a progressive neurodegenerative condition. They usually begin with the muscles that control the ability to speak or the muscles in your hands or your feet. And it gets progressively worse and worse and you become weaker and weaker and weaker. So our next one, autism. This covers a wide variety of mental disorders and they vary in severity, but they all impact a person's ability to communicate either with verbal or nonverbal means. Social interactions can impact brain development. Because it is so broad of a condition, it's usually referenced as autism spectrum disorder. Our next term, Bell's palsy. This is a condition where you have a paralysis of the muscles on one side of the face. And this is a temporary condition. Cerebellitis is the inflammation of the cerebellum. Now this term is not used that much anymore. It's a fairly obsolete term. See, our next term, cerebral aneurysm. An aneurysm is where you have a bulge or a ballooning within a blood vessel. And the cerebral aneurysm is this situation, but in a blood vessel within the cerebrum. So whenever you have an aneurysm, there's always a risk of that aneurysm rupturing, which will lead to an immediate loss of blood. So when this happens inside the brain, this can be incredibly dangerous. Our next condition, cerebral atherosclerosis. Atherosclerosis in general is when you have a thickening or narrowing of a vessel due to the deposits of fatty materials called plaques. When this happens in the cerebrum, it's called cerebral atherosclerosis. Anytime that you block or obstruct a blood vessel, it's always a dangerous situation, but it's even more so when this happens inside the brain. The cerebral embolism. Embolism is where you have a traveling blood clot that's broken off from its original site and can go to anywhere else inside the body, and it'll eventually either go to the lungs or the heart or to the brain, and when it reaches the brain, it's a cerebral embolism. So this can easily lead to a stroke. You're obstructing blood supply to parts of the brain, which is the very last organ you want to block blood flow to. And related to that would be our next term, cerebral thrombosis. A thrombosis is a blood clot. So when this happens inside blood vessels of the brain, it's a cerebral thrombosis. So any four of these conditions are dangerous just in general, but when they happen inside the brain, they become even more dangerous. Here's an example of how a cerebral aneurysm would look. You see these very large vessels here, here, and here. All three of these are aneurysms, a ballooning or a bulging within these vessels. And you can almost think of these as water balloons. You can only fill them up so much until they get to a point where they just rupture and just explode. So when that happens, you're talking about a major loss of blood, which is bad enough by itself, but it's impacting the brain. So an aneurysm inside the brain can be something critical. So our next term, cerebral hemorrhage. This is where you have bleeding inside of the brain. This is an emergency situation. It's also called a hemorrhagic stroke. Our next term, CP, cerebral palsy. This refers to a collection of problems. It can impact anything from body movements to posture to general muscle tone. The person may have spasmic paralysis. There could be intellectual disabilities. There could be vision problems. This references a very wide range of issues. CVA, cerebrovascular accident, is another term for a stroke. This is the sudden death of brain cells due to a lack of blood flow and a lack of oxygen. And our last term here, coma. This is a state of very deep unconsciousness that may last for a short amount of time. It may be a very long time. It's usually caused by a severe illness or a severe injury. See, our next term, concussion. This is a temporary unconsciousness. It's caused by a blow to the head. And sometimes this term is used to reference the confusion after the injury or the temporary incapacity caused by the injury. If this is severe enough, this could lead to a TBI, traumatic brain injury. And this could lead to either temporary or permanent impairment of physical, psychological, and cognitive function. Encephalitis, the inflammation of the brain. Encephalomalacia, I'm going to break down that term. Encephalo means brain. Malacia means the softening. So this references a softening of the brain tissue. Epilepsy, this is a neurological disorder that is marked by recurrent episodes of having a loss of consciousness, convulsions, and abnormal electrical activity within the brain. Glioma, this is a malignant tumor found in the glial cells. These are the supporting cells of the nervous system. If that were to happen here in the cerebellum, it could get so large where it can actually press against the brainstem, which would cause an impairment of the reflexes and also of motor function. Alright, this image we have a PET scan of a glioma. The normal brain activity is in that green and purple color, but this big yellow mass here is the tumor. That yellowish color indicates a very high rate of metabolic activity. Hydrocephalus, also known as water on the brain, is a condition where you have a fluid buildup in the brain itself, typically in younger children. Meningioma, this is a tumor that rises up from the meninges, the protective membranes that cover the brain and the spinal cord. Usually benign, not all the time, but most of the time they are benign. Meningitis, an inflammation of the meninges. Meningoceal is a herniation or a protrusion of the meninges through a bone in the vertebral column. Now our next term, meningomyocele. This is a protrusion of not only the meninges but also of the spinal cord through a defect within the spinal column itself. This is an example of spina bifida. Spina bifida is a birth defect where the spinal canal doesn't close completely before the baby is born. This is also called a neural tube defect. In this illustration, we have an example of a meningocele. This is the herniation of the meninges. It's basically poking its way through the space between these vertebrae. And this illustration is of a child that has not only spina bifida, but also with a large meningocele, or spinal column did not fuse completely, so the contents of the cord or of the spinal column are able to protrude outside of the body. The MS, multiple sclerosis. This is a chronic degenerative disease of the central nervous system where there's a gradual destruction of a protective coating of neurons called myelin. And as this protective coating gets torn away, the cells are exposed, and these cells are more prone to becoming damaged and infected and then eventually destroyed. So this is an autoimmune condition. Myelitis, this is the inflammation of the spinal cord. Alright, this illustration we have an example of multiple sclerosis. We're going to zoom in on this one piece of the brain here. A normal neuron should look like this, and these sections of yellow coating are called myelin. When someone has MS, this protective coating gets eaten away. So you are exposing parts of the axon to pathogens that can disable it or can actually destroy it. This will be a degenerative disease where there will be a progressive loss of brain function. Alright, this image we have a MRI scan of someone with MS. The areas that are in blue are lesions of multiple sclerosis. So here, some here, and here and here. So our next term, narcolepsy. This is a chronic sleep disorder where a person will have an overwhelming feeling of sleepiness during the daytime and will have sudden attacks of sleep. Neuritis, inflammation of a nerve. Say when this happens to multiple nerves all at the same time, it'd be polyneuritis. Those are related to our last term, intracranial pressure. This is a reference to the amount of pressure between the skull and the brain tissue itself. If you have multiple nerves inside the brain that are inflamed or infected, they will cause this intracranial pressure to go up. Neuroma, this is a tumor found within a nerve. Neuropathy is a general term that applies to any disease of a nerve. And when this condition happens to multiple nerves all at once, that'd be polyneuropathy. Paraplegia, this is having the paralysis of the legs and the lower body, typically because of some injury or a disease. If the paralysis is only limited to one limb or one region of the body, then that would be considered monoplasia. If the paralysis is limited to half of the body, or one side of the body, then it would be classified as hemiplegia. If there's paralysis in all four limbs of the body, that would be quadriplegia, because quad is reference to four. So next term, PD, Parkinson's disease. This is a degenerative disorder of the central nervous system that mostly affects the motor system. Some common symptoms of this would be tremors or shaking, usually within the hands or in the fingers, very slowed movement, having very rigid muscles, impaired posture or imbalance, changes in writing and in speech. Poliomyelitis. This is an infectious viral disease that affects the nervous system. It can lead to either temporary or permanent paralysis. This is also called infantile paralysis. Ventriculitis. This is inflammation of the ventricles of the brain. The ventricles of the brain are where you'll find the cerebrospinal fluid washing around inside. All right, I'll talk about some treatments, procedures, and devices of the nervous system. Some word parts. The first ones, the prefixes. An means lacking or without. Epi means above. Some common combining forms. Angio is a vessel. Cerebro references the cerebrum. Cranio references the skull. Duro is a reference to the dura mater, which is one of the meninges that help line and protect the spinal cord and brain. Echo is a reference to reflected sound. Electro is a reference to electricity. Encephalo is a reference to the brain. Esthesio is a reference to nervous sensation. Ganglio is a reference to ganglion, which are cell bodies of the nervous system. Myelo is a reference to the spinal cord. And neuro is a reference to nerves. Psycho is a reference to the mind. Radico means root. Rizzo also is a reference to root. Tomo is a reference to cutting. Vago is a reference to the vagus nerve. So common suffixes you'll see. Al means pertaining to. Algesia is a sensitivity to pain. Ectomy, the surgical removal of. Gram is a record or a test result. Graphy is a recording process. Ia means condition. Iatry refers to treatment. Ik means pertaining to. Ist is a specialist. Logi means the study of. Lysis means a separation or a breakdown or destruction. Plasty is a surgical repair of. Araphy is a reference to a suture. Tome is an instrument to cut. And tomy is the process of cutting. Alright, now we'll talk about some specific treatments and procedures and devices. Our first term, analgesics. This is another term for a pain reliever. Some common ones are aspirins and acetaminophen. Now, some of the stronger forms of analgesics are the opioid analgesics. These are narcotics that help to alleviate pain. Some examples of these would include OxyContin, Percocet, Vicodin. All of those are technically pain relievers, but these are based from an opiate source. These are narcotic pain relievers. Because they work so well, because they are so strong, it's very easy to become addicted to these types of pain relievers. Anesthesia. This is being in a condition of being relieved of pain. And a person that specializes in administering drugs to get you into this condition would be an anesthesiologist. So if we were to break down that term, an means without, or the absence of, anesthesio, sensation, and logist, the one who studies. So one who studies the absence of sensation. So our next term, cerebral angiography, is a diagnostic test that will help visualize the blood vessels within the brain, and also of the head and neck in general. So next one, CT scan. The CT stands for computed tomography, also known as a CAT scan. This is a very detailed visual technique that gives you much higher quality images than a common X-ray would, because you get a series of images, a series of slices through a region of the body. Craniectomy. This is the surgical removal of part of the skull. And to do so, you need to cut into the skull, and that process would be called craniotomy. Alright, in this image we have examples of cerebral arteriography. These four images show the blood flow of vessels into the head and neck area of this patient. Alright, in this image we have an example of craniotomy, where you're cutting into the skull, and this is done to attach electrodes to this person's brain to monitor activity of that area of the brain. So next term, an echo EG, echoencephalography. This is of using ultrasound waves to investigate structures of the brain and of the skull. The effectual drug therapy is a general term that applies to using medications to treat disease. EEG, electroencephalography. We're going to break down that term. Electro means electricity. Encephalo means brain. Graphy is a recording process. So this is a recording process that will help monitor the electrical activity of the brain, an EEG. Here's an example of how that would look. This young girl is going through the process of an EEG. You can see the various electrodes that are placed on top of her head, and brain activity is being monitored here. Next term, epidural. This is a reference to the dura mater, which is one of the meninges that lines or that protects the spinal cord and the brain. And there's a space just above that. That's where the epi part comes in. So it's the epidural space. Most people will be familiar with this term if they or someone they know has had a child, and then during the labor process they received a drug as an epidural. And the whole point is to alleviate the pain of childbirth. And the epidural isn't the name of the drug. The epidural is the location of where the drug is administered, in the epidural space. Evoked potential studies. And evoked potential is a term given to electrical activity in the brain in response to certain stimuli. How well does the brain react when it is provoked to a certain stimuli? That is an evoked potential. Our next term here, ganglionectomy. This is the surgical removal of a nerve ganglion, a cell body of a neuron. Lumbar puncture is another term for a spinal tap. It's called that because the area of the spine that is punctured is the lumbar region of the spine, your lower back area, and your spinal cord is being punctured in order to draw out some of the cerebrospinal fluid. MRI, magnetic resonance imaging, is a radiologic exam that is very detailed, much more so than a standard X-ray would be. It uses very strong magnets to produce a very detailed, very vivid images of a patient's body. Myelogram. This is a diagnostic imaging procedure of the spinal cord. This illustration, we have an example of someone going through a lumbar puncture. The person is laid on their side, and the injection is usually done right about here, in the space between the L4 and L5 vertebrae. So lumbar number 4 and lumbar number 5. All because the spinal cord will widen just a little bit here. So you have more area to access in the lumbar region. In this image, we have a person going through an MRI exam. You lie down on this table, basically wheeled into this big donut-shaped structure, and it will spin around you. Next term, neurectomy, is the surgical removal of part or all of a nerve. Neurology is a field of medicine that deals with The study of the nerves of the brain. Neurologic. This is anything that is relating to the field of neurology or the study of the nervous system. Someone who specializes in the field of neurology would be a neurologist. A neuroscientist is someone who studies how the nervous system actually develops. And a neurosurgeon is a surgeon that specializes in the nervous system, so the brain and of the spinal cord, and all the peripheral nerves. Neurolysis. This is applying a physical agent, such as heat or cold or certain chemicals, to temporarily degenerate a nerve in order to temporarily block a nerve's transmission ability. It's usually given as a way to block pain, also called a neurolytic block. Neuroplasty is the surgical repair of a nerve. Neurorrhaphy, joining nerves together by sutures. And neurotomy is the cutting into of a nerve. So next term, a PET scan, positron emission tomography. It's a very detailed, very vivid type of imaging technique. More detailed than X-ray, more detailed than an MRI or a CAT scan. And this is done by injecting radioactive dyes into the body and then tracing that material as it courses through certain portions of the body and checking for how well that material is absorbed by different parts of the body. Psychiatry. This is a field of medicine that deals with the study and treatment of mental illness and of emotional disturbances and abnormal behavior. And someone who specializes in this field of medicine is a psychiatrist. Psychiatrists may be involved with the next term, psychopharmacology. This is a study of how drugs affect a person's mood, thinking, sensations, and behaviors. And psychiatrists may also use psychoanalysis. This is a method of treating mental and emotional issues by having a patient talk about their feelings and their dreams, their memories, and then analyzing how those memories, how those feelings, how those emotions are described by that patient. So the patient is encouraged to talk freely about these issues in order to gain a deeper insight into how that person thinks and how their mind works. Psychology. This is the study of behavior and of the mind. This is an academic discipline and also an applied science. But people who specialize in this field, clinical psychologists, these are not medical doctors. They have a different type of training compared to a psychiatrist. A psychiatrist is a medical doctor. They can prescribe drugs. A psychologist cannot. In clinical psychology, this is a field of psychology concerned with the treatment and the assessment of mental illness and disability. Our next term here, psychotherapy. This is a treatment of a mental disorder by psychological means as opposed to medical means. So instead of using medicines or drugs, you're using very psychological techniques, talking about your dreams or your issues and finding a way to treat a mental disorder or a mental issue by other means and not just rely on the application of a drug or a medicine. Radicotomy is a reference to the cutting into a nerve root. Reflex testing. These are some simple physical tests that help check the nervous system function. There are some very common, very expected results that a person should have through the very common stimuli for reflexes. And if those results are abnormal, that would indicate there's something wrong with the nervous system somewhere. That's related to our next term, DTR, deep tendon reflex. This is done to test the integrity of the spinal cord and of the peripheral nervous system. And the response to this reflex isn't what it should be. That usually indicates a neuromuscular disease. So our next term, TPA, tissue plasminogen activator. This is the name of a protein that is involved with the breaking down of blood clots. Once blood clots are formed, they only last around 10 days or so, because you don't want blood clots to be there permanently. Once they serve their purpose and the injury is healed, they need to be broken down and dissolved away to allow for blood to flow through that area normally again. And this is what TPA does. And this is the kind of protein that's used in certain thrombolytics. So this will be used in certain drugs to help break up dangerous clots in the bodies, in particular the brain. These are commonly called clot-busting drugs. Our last term here, vagotomy. This is a surgical operation where you're cutting into one or more branches of the vagus nerve. Alright, now we'll talk about some mental health diseases and disorders and the word parts. First, the prefixes. Bi is a reference to two. Dis means abnormal or painful. Some common combining forms. Mento is a reference to the mind. Neuro is a reference to nerves. Freno is a reference to the diaphragm or the mind. Psycho is a reference to the mind. Schizo is a reference to split. Somato is a reference to body. Common suffixes. Ia is a condition. Ik means pertaining to. Lexia means word or phrase. Mania means an obsessive preoccupation with. Osis is an abnormal condition. Pathy is a disease. And phobia means a fear of. Now we'll talk about some specific mental health diseases and disorders. The first one, anxiety disorder. This is a category of mental disorders where a person will have feelings of fear or anxiety, where the anxiety is a worry of future events, and the fear is a reaction to current events. And these feelings can become so overwhelming that they result in physical symptoms, racing heart, shakiness, and this can interfere with your normal day-to-day life. The fear and anxiety can be a constant issue and can be overwhelming. The ADD, attention deficit disorder. This is a disorder where the inability to concentrate on one or more tasks for any length of time. And it's not being absent-minded, it is the inability to be able to focus on more than one or two things at a certain time, or for a short amount of time. That's related to our next term, ADHD, attention deficit hyperactivity disorder. So this is a chronic condition that's marked by persistent inattention, hyperactivity, and sometimes impulsivity. And this usually begins in childhood, and it can continue on into adulthood. So our next term, bipolar disease. It's formerly known as manic depression. This is a mental illness where you have severe highs and very severe lows in a person's mood. So you have two polar opposites of extremes when it comes to a person's emotional state. So feeling really, really good, and feeling really, really bad. So these drastic mood changes can cause severe changes in sleep, energy, thinking, and behavior. Dementia. This is a chronic disorder where the decline in mental ability that is severe enough to interfere with a daily activity of a person. So memory loss is a good example. So it's not just the fact that someone is getting older, not that they're just having senior moments. Dementia is more serious than that. It is the impairment or the loss of intellectual ability, personality, integration. It impacts their day-to-day normal life. Dyslexia. This is a general term that applies to having difficulty in learning to read or interpret words or letters or symbols. They don't affect the intelligence of the person, but they do interfere in how that person learns. Alright, this image we have an example of someone with bipolar disease. You see the two extremes here, the manic, where someone's really, really happy, and the depressive side, where they're really, really down and depressed. When someone's manic, very elevated mood, loud, rapid speech, hyperactive, delusional thoughts, really, really over-the-top excited, over-the-top happy. And then on the other extreme, the depressive side, reduced and slow speech, very negative views, very fatigued, suicidal thoughts, insomnia, a reduced interest in any type of pleasure. So this is bipolar disease, going back and forth from a very manic state to a very depressive state. Mania. This is a mental illness that's marked by really, really great excitement and euphoria, overactivity, delusions. So it's the higher end of the bipolar disorder, or the manic stage. Neurosis. This is a psychological state that is characterized by having excessive amount of anxiety or insecurity, but there's no other evidence of a disease there. So these are caused by depression, anxiety, hypochondria, obsessive behaviors, paranoia. This is a mental condition that's characterized by an unwarranted jealousy or an exaggerated self-importance or the feeling that everyone is out to get you. There's a general loss of touch of reality with the person. This could be due to drug abuse or schizophrenia or a personality disorder. Phobia. This is having an extreme or an irrational fear of something. Now, it's normal to be afraid of things, but a phobia is having an extreme aversion to something for no rational reason. Their next term, PTSD, post-traumatic stress disorder. This is a mental condition that is triggered by an extreme or terrifying event, either by going through it yourself or by witnessing it, being in a car accident or seeing a severe car accident, seeing a plane crash, being in war. Anything that's very extreme, very violent, very terrifying, can lead to the person having flashbacks later on, or nightmares, or severe anxiety, weeks, months, years, or even decades after that point. Psychopathy is a general term for a mental illness or a mental disorder. Psychosis. This is a severe mental disorder where the person's emotions and thoughts are so impaired that the person has lost contact with all reality. So the person will have radical changes in personality, and they can't function on a normal day-to-day basis. Psychosomatic. This term describes conditions that are a result from, at least in part, due to mental causes. The physical symptoms are either caused or made much worse by psychological factors. So the more the person obsesses about that condition, that obsessive behavior is making those physical symptoms much worse. So it is a connection between the mind and the body. That's why I say psychosomatic. Psycho references the mind, somatic references the body. Schizophrenia. This is a long-term mental disorder where the person has lost all touch with reality. People who suffer from this condition have a disintegration of their personality. They go through delusions, they have hallucinations, they have severe changes in their behavior, which borders on the dementia. And basically, the people who suffer from this condition interpret reality in a very abnormal way. And this will completely overtake their day-to-day life where they can't function at all because they can't interpret reality normally. Break down this term more closely. Schizo means split. Phreno means mind. And ia, a condition of. So you basically have a splitting of the mind. Alright, now we'll go over some common abbreviations of the nervous system and of mental health. AD, Alzheimer's disease. ADD, attention deficit disorder. ADHD, attention deficit hyperactivity disorder. ALS, amyotrophic lateral sclerosis, or Lou Gehrig's disease. CNS, the central nervous system. CP, cerebral palsy. CSF, cerebrospinal fluid. CAT scan, CT, computed tomography scan. CVA, cerebrovascular accident. DTR, deep tendon reflex. Echo EG, and echoencephalography. EEG, electroencephalography. EP, evoked potential. LP, lumbar puncture. MRI, magnetic resonance imaging. MS, multiple sclerosis. PD, Parkinson's disease. PET, positron emission tomography. PNS, peripheral nervous system. PTSD, post-traumatic stress disorder. TBI, traumatic brain injury. TPA, tissue plasminogen activator. Alright, we'll end this chapter with our combining form quiz. Terms on the left: neuro, mento, radico, duro, or myelo. They'll match up to either spinal cord, nerve root, hard, nerve, or mind. First one, neuro, goes to nerve. Mento goes to mind. Radico goes to a nerve root. Duro goes to hard. And then myelo goes to the spinal cord. Here are the 5 terms correctly matched to their definitions. That brings us to the end of chapter number 13. We will continue our video series on medical terminology with our next video on chapter number 14.